Harvard educated. She has her own practice. You see her on 9 News as their medical expert. Dr. Kohli today with Health Tidbits. It is Jenny D. And what our topic is today is going to be cervical cancer risks, HPV.
That's right.
And so why don't we start with what is the virus that causes it?
So HPV, human papillomavirus, it's interesting. It causes cervical cancer, but it can also cause penile cancer, anal cancer, vaginal cancer.
Wow.
And it's like a cancer associated with the virus and a cancer associated with sexual activity. And that's what makes this really unique, is that we don't normally think about cancer caused by infections or caused by sexual activity, but in this case it is. And it's highly preventable, Jenny. And yet what we're seeing out there, if you look at the trends for cervical cancer, is that the 20-year-old women are not getting screened. They're not getting their HPV vaccines. And so by the time they're 30 and 40, the rates of cervical cancer are actually going up.
Oh, wow.
And it's really sort of a heartbreaker because the HPV vaccine, which is 90% effective against the high-risk strains of the HPV that cause cervical cancer, only 2 out of 3 adolescents have gotten it.
And that's the best time to get it, right?
That's the best time before you're sexually active. And it's really important even for the male adolescents to get it. Because like I said, it's not just about protecting a partner. It's about protecting yourself even from penile cancer, from oral cancer, because HPV can cause oral cancer as well. So parents are worried that giving their child a vaccine is going to encourage them to have more sexual activity, or there's a lot of hesitancy with RFK Jr. and others saying these types of things. But really, we need to sort of embrace the vaccine because it is so incredibly effective at preventing these
and even if after you get married, things like that, you said 30s and 40s, that's alarming.
Well, and
they didn't have this around when we were younger and stuff like that, but I do know people that have had cervical cancer that were my age and stuff, and that's scary.
Right. And what I'll tell you is if you're sexually active and you're a man, about 90% of men that are sexually active will get HPV sometime in their life, and about 80% of women. Now, the nice thing about cervical cancer is that it warns us. It takes several years to turn from precancerous into cancerous. So it really kind of is what we call indolent. But the problem is if we don't check, we don't know. So if we're not getting those regular pap smears, we're not getting what's called reflex HPV testing on our pap smears, then we don't even know if there's a cancer brewing down there.
So is it something that automatically does with your yearly exam? Like the doctors are aggressively checking for this, or is that something you have to advocate for?
So starting at the age of 21 or when you're sexually active, every woman should start having pap smears. And the kind of frequency depends on how sexually active you are, whether you've had an abnormal pap, whether you've had the vaccine, and whether you're HPV positive or not. So it's usually every 3 to 5 years. Okay. If you're getting a lot of abnormal paps or positive HPV, they might do it a little bit more frequently. But it is really important to make sure it doesn't fall through the cracks because it's not an every year thing. And so sometimes you're like, oh, I don't think I'm due for it. And then a year and another year goes by and time just kind of takes on. So what I would do is just put it in your phone or your calendar so that you remember you're supposed to get a pap smear. Every time you have a new partner, you may also want to talk to your doctor about your risk because then possibly you've been exposed. And here's the other thing I tell women. Sometimes they'll say, well, I haven't been sexually active for 5 or 10 years. Well, you could have still been infected back then. And then it starts to declare itself later in life when your immune system changes. And that's when those cells kind of wake up and start becoming abnormal. And same for postmenopausal women who sometimes have had their uterus removed. And they say, well, I don't have a cervix anymore. Well, you still have a vagina. And you could have cervical cells left behind. And we know that HPV is involved in vaginal cancer as well. So I would say have a conversation with your doctor, your GYN, because it's such an important topic. And it's something that can sneak up on us because the cervix is a very hidden part of our body.
And we've talked about this a lot on our segments. It's advocating for yourself and for making sure you're having that conversation. If you don't have a doctor that I feel you can trust to come to with questions about these things, then maybe you need a new doctor. Cherry Creek Heart in Aurora, she is accepting new patients. Thank you, Dr. Kohli, so much.
Jenny.
And be safe.